Hello, this is Christine Deal, and we're going to talk about Chapter 18 today in this section, Health Professionals and Genomic Care. This is a pretty short, straightforward chapter in your book, so we're just going to give a general overview of this section. Okay, so genomic care. So genetics professionals are necessary to ensure that genomic care addresses the influences of a person's genetic history on health and disease and is considered as part of a person's general assessment. Okay, healthcare professionals must not overlook the genetic issues. So genetic considerations are just as important as environmental ones. It doesn't mean that all patients should have genetic testing, it's just that we can't overlook genetic issues that may affect an individual's health or risk for health problems. Genetic professionals have an extensive education and often special credentialing in some aspects of genetics. And again, this is very straightforward in your book. We're going to just go over a few of them in this PowerPoint presentation. But all healthcare professionals, including nurses, are expected to have a basic understanding of patterns of inheritance and genetic terminology. Okay, and be able to construct a 3-generation pedigree from the assessment information. So genetic counseling is defined as the process of helping people understand and adapt to the medical, psychological, and familiar implications of genetic contribution to disease occurrence or recurrence. So various genetics professionals are credentialed to perform genetic counseling to varying levels. But all counseling should be non-directive, which means that all facts and options are presented in a way that neither promotes nor excludes any decision or action within legal boundaries. Okay. This may be difficult because patients may want our help to make the decisions, but they must ultimately make the decisions that feel right for them. And so our role is to present them with the information and options so they can get to that decision. Okay, a certified genetic counselor, that is a genetics professional who has a master's degree in genetic counseling from a graduate program accredited by the American Board of Genetic Counselors. They do pass a certification exam. This profession was first recognized in 1969. The United States has 37 accredited genetic counseling programs. Canada has 4, and there are other programs worldwide. So genetic counselor, their scope of practice focuses on 3 general areas. That's providing expertise in genetics, communicating and counseling patients and families at genetic risk, ensuring that counseling services are delivered in a manner that is consistent with professional ethics and values. They are members of the healthcare team who provide information and support to people and families who have an identified genetic problem or at an increased genetic risk. They may specialize, for example, in prenatal or in oncology. A clinical geneticist is a physician, typically a doctor of medicine, MD or a DO, okay, and requires a 1-year residency. Okay, and then, of course, to be an MD or DO, successfully complete a medical board exam, specialty residency, typically a year, and a fellowship as well. Their responsibilities include diagnosing, clinically managing, and counseling patients. They may work in a specialty setting or as part of a referral center for genetic disorders. I've already mentioned diagnosis, management, and counseling. They may be certified in cytogenetics, molecular genetics, or biochemical genetics. Okay, a clinical laboratory geneticist, an MD-DO, or a PhD prepared scientist in genetics or biologic science. This requires an additional 24-month fellowship. The main role here is to oversee and work in laboratories that perform diagnostic genetic tests. Okay, and they take a certification exam, and again, 3 subspecialties: cytogenetics, molecular genetics, and biochemical genetics. So, as I mentioned, they oversee and work in laboratories that perform diagnostic genetic tests. They develop and implement new tests. They provide quality assurance of routine tests. They interpret test results, and then they communicate those results to healthcare professionals. So they generally do not participate in the direct care or counseling of patients and families, but they assist other professionals to provide accurate information and explanations. Okay, so a medical geneticist is not a physician, but has a doctorate in population genetics or epidemiology. They work along with certified genetic counselors and typically teach in academic settings. A research geneticist has a 2 to 4 year postdoctoral program, and they may work with the clinical geneticist or certified genetic counselor to provide the scientific details associated with a specific disorder. So the focus of this career is in lab research to identify exact pathological mechanisms that result from various genetic disorders, and then to develop therapeutic approaches like gene therapy to reduce the effects of the pathological mechanisms. So they have a minimal role in the actual genetic counseling process. So Advanced Practice Nurse in Genetics has a master's degree from an accredited program, includes 50 hours of content, some practicum experience, evidence of effective teaching, and they are certified through a professional portfolio. Okay. Because a certification as a genetics clinical nurse is currently not available through testing, but the renewal is performed through the professional portfolio review process by the ANCC rather than by examination. Okay. And again, logs of 50 cases for studies, contact hour requirements are all listed here. Okay, so the role of the generalist nurse in genomic care. Okay, the generalist nurse has the most interaction with patients. So nurses are in positions to identify patient or families who may have an increased genetic risk for a health problem. So during assessment, the nurse's responsibility is to look for red flags of genetic risk, and the potential need for genetic referral should be kept in mind. Okay, and then discussed with the doctor. The nurse may be the one who first verifies the information to bring a genetic problem to attention. Okay. So their role is, of course, to ensure appropriate referral, serve as the patient advocate, and maintain confidentiality. So an example of being alerted to a red flag would be like if you had a patient that came in who had emphysema and they were a non-smoker. You know that this is rare, and so that would be a red flag. I mean, it's rare for a non-smoker to have emphysema, so that would be the red flag that would alert you to a possible genetic predisposition and the risk to family members. And then through further assessment, you would identify if there were other family members who were affected in the same way. So the nurse detects cues that indicate a patient is also worried or interested in genetic risk. So those are ways that those are our roles, is that we identify that and then we discuss and refer. Okay, so we do provide accurate information. Nurses provide accurate information while remembering that we are not the experts. We just work with the patient to identify and develop a family history or pedigree that includes at least 3 generations. Okay. Oh, and then also, again, in part of the assessment, just ask if the patients have mentioned their family health issues to their doctor, and then ensure appropriate referral. So bringing the MD in is the beginning of the referral process. And then, of course, we document these red flags and our discussions with the patient, and serve as a patient advocate and be present during discussions, and then help explain anything they may not understand from the genetic counselor or the physician. Okay, so that concludes Chapter 18. It's a short, straightforward chapter. So, all right, that's it. If you have any questions, just please feel free to contact me. Thank you very much.